we are live.
Great. Good afternoon, everyone. My name is Linda Jackson, and I have the great pleasure of chairing the Toronto Seniors Housing Corporation Quality and Tenant Engagement meeting for this meeting on Tuesday, May 19th. Welcome committee members, board members, staff, and our online attendees to our meeting. Thank you for joining us today, and we are live streaming on YouTube. I'd like to acknowledge that May is a busy month of important events. May is Armenian, Asian, Dutch, Jewish, Polish, and South Asian Heritage Month. May 21st, Shavuot begins, and it's also World Day for Cultural Diversity, May 24th. Is Pentecost and Hajj begins on May 25th, with Eid al-Adha beginning May 27th. May 31st to June 6th is National Accessibility Week. We have a full and exciting agenda today and a deputation on item 12 under community programs and partnerships. I'll now proceed with our next agenda item, which is our land and ancestral acknowledgement. Toronto Seniors Housing Corporation recognizes that we live and work on the traditional territory of the Anishinaabe, the Haudenosaunee, and the Wendat nations, and that this is the area is now home to a diverse population of First Nations, Inuit, and Métis people. We recognize that Toronto is situated within the traditional territories governed by the Dish with One Spoon Wampum Treaty between the Haudenosaunee and Anishinaabe nations, the Two-Row Wampum Treaty between the Haudenosaunee and the Dutch, as well as Treaty 13 and the Williams Treaties involving the Anishinaabe and the Crown. These agreements remain in effect today, underscoring our shared responsibility as treaty people. Toronto Seniors Housing has benefited from these treaties and the resources of this land by providing essential housing services to seniors in Toronto. We are dedicated to furthering reconciliation initiatives, which include facilitating staff education on the historical and ongoing impacts of policies affecting Indigenous people. This encompasses topics such as the Indian Act, residential schools, treaty violations, and the continued crisis surrounding missing and murdered Indigenous women and girls. I'll just try to slide my computer down. Sorry, guys. I'll now do the African ancestral acknowledgement. Toronto Seniors Housing Corporation acknowledges the racism and injustices faced by individuals who are brought to the land involuntarily, particularly through those affected by the transatlantic slave trade. We acknowledge the experience of Black peoples who arrived in Canada seeking a better life, following the abolition of slavery by the British people in 1834, while also recognizing the structural, systemic, and individual racism that they encountered, which continues to persist today. This racism culminated in the tragic destructions of Africville, which was once the largest settlement of the Black community in Canada. Toronto Seniors Housing is committed to recognizing all forms of racism, especially anti-Black racism, and is actively working to combat these injustices. We'll now go to our next agenda item, which is new business and approval of the QTEC public meeting agenda. Okay, does any board member or committee member have any new business or any amendments for the agenda? Jess? No?
I'd like to know
Oh, we
how
can.
to, I'd like to know how to depute to the committee regarding Stack's manifesto for seniors. I know it's been brought to the attention of the board, but I don't know how to present it to QTEC.
I'm not sure how a board member deputes. I think you could add, as a board member, you could actually raise that as an agenda item or an additional. Does anybody want to help me with that in terms of the procedural process for adding that? Or so you can speak to any item that comes up on the agenda, Jess, without deputing as a board member. Is that a new agenda item? Is that what
It
you're
was
wanting to do?
suggested that there was too much to deal with this particular meeting to add it to the agenda, and it was a very short time period. So I thought it might be simpler just to do.
Linda, if
Yeah,
I may.
thanks, Grant.
So,
Help me out.
um, items can be added to the agenda by any committee
Yeah.
member with the approval of the committee.
Yeah.
However, sometimes in consideration of the item, you may want to, if there are materials, for example, and I think what Jess you're speaking to, there would be materials that would be accompanying this item. This might be something that you might want to consider for, let's say, the June 1st QTE meeting, and that would give some time to circulate materials in advance for folks, if that makes sense.
Yeah, Jess, I think I mentioned previously that we had so many agenda items for this meeting that we actually have broken it into 2 meetings. So I
Yeah,
wonder
I
what your
understand. I
thoughts are
appreciate
about
that.
that.
Yeah, I'm
Would
happy
that
to
work?
do it on June 1st. Yeah.
Okay, okay, and then we can actually, we can add it as an agenda item, and you can certainly speak to it. We can bring it there. So thank you for bringing that, and thank you, Grant, for helping me out with the process.
Thank you both.
Okay. Anyone else? Okay, then can I have a hearing none? May I have a QTech member move that the May 19th, 2026 public meeting agenda be approved as circulated? And it's Jess, thanks, and thanks very much. That's great. We got Jim there on the second, for seconded. All in favor? Terrific. Great. We have a small committee member committee attendance today. So Jim and Jess are going to be seconding, motioning a lot of things. So thank you in advance for that. Okay, so we will move on to so with that, all in favor, be it resolved that the May 19th public meeting agenda as presented is approved. We'll now proceed to item number 4, which is any conflicts of interest. May I call for any declarations of conflicts of interest? Anyone have any conflicts of interest? Great, thank you. And as we go through the agenda, if anything does come up that is a conflict, just feel free to flag it for us at that point, and we'll take that into hand. So hearing done, we will move on to item number 2 under 5, which is the approval of the QTech minutes. Does anyone have any comments or edits of the QTech minutes from February 23rd, 2026? That just seems like yesterday, but it's February. Hearing none. Do I hear any? None? So hearing none. May I have a QTech member move that the February 23rd, 2006 minutes be approved? Jim, Jess, terrific. If you have any issues with that, all in favor, great. And we'll now move to the item number 6, which is the action item review. And thank you for putting those action items together. I'll pass it on to Grant to discuss any items on our list.
Thank you. And good afternoon again. So through the committee, to the chair, there's one action item outstanding on the list. It's from November, and it's to bring to the board and committee a Bill 10 and Bill 60 effects to TSHC. I can let the committee know that we do have some material. We had our external legal. We did some research ourselves on this, but we also had our external legal put together a memo for us on these 2 bills. And we're reviewing that right now, and we'll provide an update to the committee or the board as a follow-up.
Terrific, thank you. And that's great. That came up a couple of meetings ago, and thank you for doing the due diligence on that. Any other questions
Madam
about the
Chair,
action?
Brenda
Oh, go
Parent
ahead.
has her hand raised.
Oh, hi, Brenda, go
You're
ahead.
on mute,
Sorry.
Brenda.
Just to clarify, Bill 10 and Bill 60, just briefly remind me. I think I know what it is, but just remind me what they are.
Sure. So through the chair, Bill 10, it's called the Measures Respecting Premises with Illegal Drug Activity 2025.
Okay.
And that bill is specific, and it creates obligations and potential liabilities for landlords where premises are used in connection with illegal drug production and trafficking.
Right.
There are regulations that the government is drafting right now for that. And there are also some exemptions that could potentially apply to Toronto seniors housing in that bill. Bill 60 is called the Fighting Delays, Building Faster Act 2025, and that is more specific to streamlining processes with regards to the landlord and tenant board, and there may be some considerations for TSHC in the context of arrears and processes with the LTB. So those are the two bills. We actually have quite a bit of detail in the legal review that's been done, so we're looking to just kind of discuss that and then bring forward with some context to the board a little bit more on those two.
Brenda, is that your hand still up?
Sorry, and we're deemed to be the landlord? Is that why it has?
That's correct.
It's not TCHC, but us. Okay, thank you.
Yeah,
Thank
and this was something that was referenced by one of the board members, and there was a request for from a board member to get more information on how it does impact on us. So we haven't really had the conversation yet, and I'm sure it will be educational when we do. So thank you for that, and thanks for the clarifying question, Brenda.
And that will come back to this committee, or would it be the board?
Is it the board or here?
Through the chair,
Would
we're
need to be the
looking.
board.
We haven't decided, but I think what we were intending to do was probably send a summary of you out to the entire board, and so there's an awareness at the board level.
Thank you. So we'll leave that as an action item until we actually have it will come to one of them since it's sitting on our action list. We'll make sure that it actually goes to the right place. All right, thank you, Grant, for that. Then thanks, Brenda, for raising it. So if there aren't any other questions with regards to that, we'll move on to number 7, which is our report from our CEO, and Tom's here to report. Tom, thanks.
Yes, thanks, Linda. And through the chair to the committee, really had one main item to share with the board today. How I did just want to reflect back on Jess's remark about bringing the manifesto, the seniors manifesto, bringing it to the QTech on June 1st. June is Seniors Month. So I think it's very appropriate that we bring forward that work of STAC led with Jess and that small committee of STAC to the June 1st meeting regarding the manifesto. So thanks, Jess. I would like to inform the board of a new initiative that Toronto Seniors Housing has recently joined, focused on improving access to primary care for tenants. Earlier this year, if you recall, Toronto Seniors Housing provided letters of support for 2 integrated primary care treatment applications to the province. So you may have the acronym is the IPCT, and this is a group of doctors, nurse practitioners, social workers, dietitians under one roof who provide connected and convenient care. And the province is heavily into expanding these teams to connect everyone with primary care. And we have been notified that one of those applications, which was led by Community Care Health, has been approved. And so that is an organization, a group in the Southwest region. And this includes a range of healthcare and community partners, including family health organizations, hospital providers such as CAMH, the Center for Addiction and Mental Health, St. Joe's Health Center, and several community agencies. For Toronto Seniors Housing, more specifically, our role will be to help identify tenants who are not attached to primary care. And support referrals and coordinate as appropriate on-site services with healthcare partners in the buildings. The program has committed to attaching up to 300 Toronto Seniors Housing seniors to primary care. So that's a good number. Expected outcomes include improved access to care, better coordination of services, and then ultimately would want to see kind of that reduced reliance on emergency services for seniors' higher needs. And this work is in its early stages. Implementing planning is underway, and partners are meeting to develop an approach for Ontario Health. And as next steps are confirmed, we would be pleased and working with our partners, and then we would start to identify priority buildings and then beginning that outreach. And as this, certainly I think this is an exciting, and as it unfolds more and we have kind of more clarity and specificity, we can bring updates to this committee. Thank you.
That's great. I see Brenda's hand, and I had a question as well. Go ahead, Brenda. Brenda? I think we lost Brenda.
She
It's
looks
not me, right?
frozen.
Yeah.
No, she's frozen.
Maybe I'll ask a question, Tom, and that is, do you see the opportunity, if this is successful, for us to be proactive in reaching out to other parts of the city where we know that there's actually, more vulnerable groups, or even doing a bit of a, Deanna may be able to answer this. Like, it would be interesting to know how many people, like, if they were willing to provide that information, are unattached in buildings, and which areas in
right.
the city we might want to target.
That's right. Yes. Through the chair to the committee. Absolutely, Linda. I just think this helps to build out even more kind of
Mhm.
our reach and the involvement of the kind of primary health in supports to our buildings. And
Yeah,
so, with this work, and if we identify X number of people who aren't attached, and then, I'm sure with, like, when we look at the Northwest through our Baycrest buildings, right,
yeah,
where there still might not be, I do think this will really help us to provide an impetus for even for the northeast and the southeast to drive a bit harder to get some of that greater
yeah.
connectivity that I hope this brings to the southwest and that we have in the northwest. So I think it can be a real precipitator for for ongoing work. Thanks.
Great, great. It would be great to see something in the downtown east as well, considering some of the
Exactly.
buildings that have come up with the vulnerabilities, that kind of mirror
Absolutely.
some of those, the southwest as well. So that's great. Thanks, Tom, for that, and that's a wonderful initiative.
Hmm.
Great, great. Hopefully, Brenda will come
Stephanie
back
has
on.
her hand raised.
Oh,
Maya?
sorry. Thanks, Jess. Go ahead.
Yeah, congratulations, Tom, on this project. I don't know if it was founded on the study that was done last year by Arlene, but certainly it's a step forward, and implementing more services available to our aging population, of which
Yeah,
almost 20% are over the age of 85. They may
yeah,
or may not have primary care, but many of them will also need at-home care. So getting out to doctor's appointments, particularly in winter, is a challenge, and certainly having availability to services at home is essential to their well-being.
Hmm. Yes.
yep. Thanks, Jess. Did you want to add something, Tom?
Yes, through the chair to the committee and Jess. Yeah, I just want to build. I do think we just remind the committee that we do have our partnership table, and which has representation, and and Deanna is going to actively involved in that for Toronto seniors, and that really, I think, helps to heighten kind of our interest and need in this area. So and keeps the agencies and other providers aware of what we are driving for. So that yeah, we want to keep the momentum.
Yeah, and if I can add, Tom, just having been a little bit involved with the development of these teams in the past, I was a bit surprised as the government was rolling out that seniors weren't particularly mentioned as a vulnerable population, and there
Hmm.
hasn't been a lot. So even doing some proactive, now that there's so much that is happening, and people are looking for partnerships, and when we have actually such great resources to say, these are the buildings and we can help you, I think would actually be a real benefit, and maybe advocating a little bit more with Ontario Health that seniors really like. There's an incentive to actually take on patients that actually might take longer to care for, and whose care is more complex than the average person that is actually just unattached to
Hmm.
primary care.
Thank you.
That's great. Thank you. So that's so keep us informed, and we look forward to the presentation at the end of the meeting around the partnerships, which will dovetail nicely to this. We'll move on to item number 8 now, which is our operational dashboard. And as a reminder, this is our regular dashboard that Brad and company put together so nicely, and we're looking for trends. And I'll pass it over to Brad.
Thanks, Linda.
Yeah, so on the overview slide here, we do have the arrears again have come down a little bit more. They're in that under that $1.4 million range now. And as you can see, most of the arrears are well managed. The vacancies are back down from that kind of Christmas, post-Christmas bubble that we always seem to experience. We're back under that 1.7%. With regards to the work orders and the administrative tickets and the pest management, I'll get into those in a couple more slides. The pest management mainly in the next section in the presentation. Next slide, please, Karen. Yeah, so as I mentioned before, you see that the arrears have been dropping, so they're down to that $1.38 million mark. And that includes almost $120,000 that are sitting with the Ontario Public Guardian and Trustee waiting for the PGT to either take over or to advise that they're not going to take over these accounts so that we can ensure the tenants get the proper supports that they need. Next slide. Vacancies, we're into that during the Christmas holiday season. We always seem to have that bubble. We got the bubble. We're back down to our December levels of a 1.69 vacancy rate. We continue to turn units over in extremely fast fashion. We're about 66 days from the time someone moves out to the time somebody else moves in. And according to the other providers in the province, that's the best number that's seen in the industry. Next slide, please. For the maintenance and the work orders, again, the one thing I'm going to note here, and I'll get into it a little bit later, is you can see on the top 5 vendor work orders, we've got the pest control, and that really kind of contributes to that spike that you see in March of work orders and the numbers going up. And we'll get more into the reasoning behind that when we get into the pest control report, which is the next item on the agenda. But it mainly has to do with the effectiveness of the training that we've put all of our staff through. Other than that, the slide gives a breakdown with regards to the percentage of work orders done by staff versus vendors, as well as the completion timelines. Next slide, Karen. Administrative tickets. You can see there's been a large spike. It's almost doubled. This is the time of year where tenants are starting to receive their tax returns. They're receiving their taxes, and it creates a large number of tenants that come in to see the senior services coordinators, and they want to have their rent adjusted accordingly based on their new income and the tax documents that the CRA has provided them. Next slide, please. And then pest management, as noted, there's a pest management report that's the next item up, and it's probably better to go through these numbers when we get to that report because it offers a lot more depth and a greater level of insight into what's actually occurring within the buildings. But this does provide the committee with a number of units that we've provided preparation to assist staff, tenants with, provided replacement beds, as well as our collaborations with Toronto Public Health.
Brad, I see that Jess has his hand up, so maybe I'll just ask Jess before you get to the end of it. Jess, did you have a question first? I wasn't meaning to cut you off, Brad, though. You can complete it too.
No, it's an complication. You went in time.
Jess, you're on mute.
Yeah, I took my hand down but didn't unmute. To the chair of the board, I had a question regarding the reportage of deaths. Living in a TSHC building and having had 3 people that I know of die, 2 of them in challenging circumstances over the last several months, is there a year-over-year gain of number of deaths? Because it 3 out of 69 seems to be unusually high for a short period of time. I don't know if there's any figures that would indicate whether or not this is a growth in number of deaths, or if this is a sort of a stable number that should be anticipated.
Yeah, thanks, Jess. And through the chair. So 31 units were turned over due to the deceased tenants. It's an unfortunate thing about working with the seniors and the seniors portfolio, and I think it's something that we might have to deal with more often as we continue to succeed in assisting people in aging in place. It's just one of those facts that goes along with it. There is usually annually, there is a move out report that I provide the committee that gives a greater level of detail. And it looks at those trends that you're talking about, Jess, and kind of mapping them out to see if there's a year over year increase or decrease in any of the particular categories. I'm happy to dig out the last one that I provided the board or the committee, and I'll send it over to you.
Thanks, Brad. And it is an interesting comment, though, that Brad makes. That on one hand, we don't, it's sad actually to see the number of deaths. On the other hand, it's also great that to see that people are actually staying in their own residence, because so many people want that. We don't know all of the fine details with every situation that comes up with this data. Brenda, you're back. Welcome.
Yeah, to add to that, 2 of the 3 deaths in our building were undiscovered for several days.
Yeah.
Yeah, that's
So
really hard.
The services are needed to be accelerated if we're going to have older people living in the buildings.
Yeah, yeah.
And that's just anecdotal, but I don't know if it's also reflected in other buildings.
Yeah, thanks, Jess. It's just really in the last little while that we were actually asking for all of the details on where people are going, and what is the status of people when the apartments turn over. So it's something that we should definitely keep an eye on. Over to you, Brenda.
Hi.
She went on.
You went on mute again.
Hi, can you hear me now?
Yep.
Good, sorry about that. Just the number again, sorry, I didn't quite hear the
The
number
number
of deaths. Was it
of deaths was 31.
31 for the whole year or for the quarter?
No, Brad, do you want to speak to it? You'll do better than me.
Thanks, Lynn. Through the chair. That's for the year to date, Brenda.
Okay.
Oh, I think Brenda is having a connection issue today. We're losing you again, Brenda. All right, I cut you off, Brad, in terms of ending your report. Was there anything else that you wanted to highlight with regards to the dashboard?
Through the chair. No, Linda, any other questions would be fine.
Any questions that anybody had about any other items under the dashboard? I didn't see anything that kind of flagged a difference than we've seen. It's good to see, and it's been helpful that you've been actually giving us like some of the trends over the year that things go up and down. I think we're seeing that as we get more sophisticated in looking at this after now 3 years. There are definitely some trends. Jess?
Yes, Brad, to the chair of the board, Brad, you're at the meeting today, and I'm wondering if any of that information will impact responses from staff and TCHC, and in a timely manner. I know these things take a while to respond to, but for example, the vendor response time. I think last time I noted that it was unreasonable, but is there any way to make the actual response time somewhat better so that their numbers improve?
It says
Yeah,
it's
through the
okay.
chair. Through the chair. Just for the rest of the committee, there was a tenant meeting at Jess's building today, which I attended, and we heard about some of the frustrations that tenants have had with the vendors that have been sent out to provide some of it, as well as a lengthy period of time for a capital construction that went on. Jess, through the chair, one of the things that I think is really going to help with that is the new agreement that we've signed with Toronto Community Housing that governs the relationship between the two companies. And I think that one of the things that's really highlighted in that is I think that the capital work at 717 Broadview could have really used the Toronto Community Housing, the planned project services team that does an increased level of tenant engagement. The old agreement really didn't allow us to push too hard as far as it was a sole determination of Toronto Community Housing. The new agreements now have dispute resolution mechanisms within them that'll allow us to if there's a disagreement as to the level of communication or the number of tenant meetings, or even if that group gets involved in it, we've held meetings and we have the ability now to push back and to escalate those issues and ensure that tenants receive the right level of communication. When it comes to the day-to-day work, we're really working with Toronto Community Housing to leverage their contracts and ensuring that the vendors stay to the timelines on those contracts. I know that Toronto Community Housing's invited us for a maintenance review of a lot of their vendors and their vendor performance, and we continue to escalate issues to them where vendors are operating outside of their contractual timelines. But it's up to Toronto Community Housing in order to leverage the relationship with the vendor to see some improvement within that.
Sounds like it was a good meeting, Jess. You raised some issues. Is that another point did you want to make, or you're good with that? Okay, thank you. Any other questions? We are going to move on to a more substantive report. Brad's on the hot seat today on the larger pest management. So if there aren't any other items or any questions on this one, we'll move on to the pest management report. I am sorry that Councillor Crisanti, I should have said earlier in my remarks that Councillor Crisanti sent his regrets. He's not feeling well today, and Fareed, our chair, also sent his regrets because of a family matter that he had to attend to. So this is an important report, and we'll pass it over to Brad, and I'm sure we'll have some questions. Thanks.
Thanks, Linda, and happy to take the committee through it. So this is a Q1 to Q1 comparison. Back in November, I delivered a report to the QTech committee of some planned services, some changes to the way in which TSHC delivers pest control within its communities. And this is an update to the board and to the committee as far as the progress that we're making. So I think the big thing that we've realized kind of from this was that we didn't properly train our staff. We have since trained all of our superintendents. We have trained over 150 of our maintenance staff with regards to how to perform block inspections, how to properly leverage the vendor and the contract that they operate within. And what we've seen have been some interesting results. So from the first chart, I can show you that we've seen an almost 50% drop in the number of units that we're actually treating for bed bugs. And we've seen an increase in the number of block treatments that we've been providing. This is really important for our tenants, because I think what was happening before we properly trained the staff was that what we were seeing was that the staff were booking bed bug treatments for people that just were living next to units with bugs. And then they had to go through preparation. We all know that that's a massive impediment in order to people receiving the proper care and the proper pest control in order to limit infestations. So that focus on training the staff has really benefited the tenants, and we're performing these block inspections and discovering more and more things as we go throughout the building. The next couple lines show the super interesting part is that although we might not have the bed bug issue that we thought we have a cockroach issue. So we've actually seen of just over 3% in the number of percent of units that we're treating for cockroaches from Q1 last year to Q1 this year. And we're just diving into it more and more, looking at the data. What it seems to be is that through the block inspections, and we know tenants don't like to report pest issues, nobody likes to admit that they have pests, but when we are going and inspecting these units, instead of finding bed bugs, we're actually finding cockroaches within the units. The good news is it's a lot easier for us to treat for cockroaches. It's a lot less intrusive for the tenants to be treated for cockroaches. So this is surprising, but it's good news in the end because it's going to be easier for the tenants to be declared pest-free. The next chart down is the percentages of units that are treated within developments. And I think this is a great one. This is one of the ones that we committed to the board and the committee on reducing the infestations in that bottom line, that greater than 20% of the units receiving pest treatment. And what we can see is that we've actually been able to do that so far this year. When you look at last year to this year, we've actually been able to move 7 additional developments into that less than 5% or less of the units that are being treated for pests. And again, this is due to the efforts of our staff. That increase that you saw that I spoke about, and the number of work orders that are being performed, those are all related to the additional things that staff are finding from these block treatments and getting into these units and properly treating the units with the proper chemicals in order to provide a pest-free environment for our tenants. Does anybody have any questions on those two charts?
Jim Meeks has his hand raised, Mr. President.
Thanks, Jim. Go ahead.
Brad, what is used for the treatment of cockroach?
So there's a few different chemicals that are used. Sorry, through the chair, there's a few different chemicals that are used. And it's one of the things, part of this is happening in connection with funding from social development and funding that we received from city council during budget time to look into it. And as part of that, Jim, we've done a big industry scan where Emma and I have met with different housing providers within the province. And one of the things we've found is that we're actually using probably the wrong chemicals. We're allowing the vendor to dictate the chemicals, whereas other providers that we've spoken to have used different chemicals. Mainly what they're doing is using more advanced chemicals that don't have repellents in them, so you're not pushing the problem around unit to unit within the building. So the chemicals are something that we're going to look at. Right now, it's a dog's breakfast, to be honest with you, though, Jim. The vendor is allowed to dictate the chemicals that are used within the building.
I've had great success in keeping cockroaches out of my unit by using the chalk that you can get in Chinese variety stores usually. And it's really inexpensive, and I think it's a compacted form of desiccated earth. I'm not sure, but that's what it feels like when you use it.
Watch out, Jim. We might put you on the cockroach team. Yeah, thanks for that. I see Jess's hand up as well.
Thank you. To the chair of the board. You mentioned the plan that was funded by City Hall, the $90,000 for two buildings to be treated. Has that shown any results, and is that part of these numbers?
Yeah, great question, Jess. Through the chair, those pilots have not yet kicked off. We're working with social development right now, and what's happened so far is that there's been a lot of leveraging of different city departments. So through social development, we've been working with Toronto Public Health. We've been working with MLS to get some of the other trends and some of the other supports. We don't want to duplicate the services. So if there's an opportunity for us to leverage Toronto Public Health to provide supports, then we're trying not to duplicate that with the use of the two pilots that are to be launched. But social development should have a report ready shortly with regards to recommendations that we've been working with them on as far as the two pilot locations and what the work will actually be with regards to that. Long way of saying no.
As a follow-up question to the chair and the board, the health implications of the various treatments to the residents. I assume that these have all been passed by some healthcare provincial group, or if not, what is the sliding scale of deleterious effects?
Yeah,
So
thanks for that question, Jess.
Through the chair and to the committee, Environment Canada, it's a federal organization, Jess, that approves the use and the application of all pesticides in the country. And all the pesticides that we use have to be approved by Environment Canada prior to application anywhere.
Thanks for that, Brad. And it's good to see that it sounds like some of this proactive work has helped actually with the stigma issue and also with some of the results. So that's great to see. Do you want to continue?
Yeah, next page, please, Karen.
Before we continue, sorry, Madam Chair, Brenda just wanted to test her audio. Brenda, if you could say hi.
Hi.
We hear you,
Oh,
Brenda.
nice and clear. Nice and clear.
Okay, I took the earplugs out, so maybe the computer microphone will catch me then.
Okay, thanks.
Thank
Good
you.
to have you back.
Thank
Thank
you.
you.
Okay, over to you, Brad.
Thank you, Karen.
Yeah, this is another one of the commitments that we made when we put forth the pest management plan that we were going to operate under, was looking at units that require multiple treatment cycles and dealing with them a little more effectively. And this really shows the decrease that we've had from Q1 last year to Q1 this year, you can see that last year we had, or in 2025, we had 256 units that in Q1 had already received multiple treatment cycles for bed bugs. And this year that's down to 141. So what we're seeing is that the effectiveness of the treatment that we're providing to tenants through our pest vendor and through our environmental health unit is really having a better effect. And we're not seeing that rebound rate that we had the previous year. The only one where you see it really is when you're looking at the blocks, and they've gone from 22 people who were inspected multiple times last year to 140 this year. And that's just, we're getting into more units. And that is actually a good thing, because when we go into for these preventative ones, the vendor goes in, there's no impact on the tenant. They don't have to prepare. They don't have to move stuff away from the walls or launder or anything. All they need to do is provide us access. The vendor's going in and inspecting all the places that bugs would hide. They're looking for where the pheromone trails might take the bugs through the unit. And the multiple inspections are ensuring that people remain bug-free throughout. The rest of the report provides some of the highlights with regards to the training that we've been providing to staff, as well as some of our upcoming actions that we have planned for the next quarter of the year. And we'll bring in a similar report to the committee then.
Thanks, Brad. And I guess I'm channeling Councillor Crisanti and saying, is there any way that we can, get even better? This is something that really impacts. I remember living in social housing, and I all of a sudden I'm reminded of some of those cockroaches and how hard that was. Is there any way that we can actually get even better?
Absolutely, through the chair, we can do a lot better than what we're doing now. We're just in the beginning stages of this project, and it's just going to keep building off of it. I would say that some of the other housing providers that we've spoken to have gone from like 30% infestation rates down to about 6%. It's the lowest that we've seen among the other social housing providers. And we're riding around that 15% range right now. So there's a lot of runway for us to make some excellent progress and improve the lives of our tenants here.
That's great. So we'll tell Councillor Crisanti that we're aiming for 6% or 5% because we want to be the best. Okay, thanks. We'll minute that. Yeah, keep up the good work. I mean, I think it's like I said, I think that this is something that really is important, and particularly with seniors that are homebound seniors and others that, it's great that we're seeing some progress in that way. So thanks, Brad. Any other questions or comments with regards to that? All right. We have a lot of really important reports that have been important to this committee and to others. And the next one is also, are we ready, Karen, for the community safety strategy?
Hi, Madam Chair. Just waiting for our guests to arrive. Maybe we could defer back to Brenda. She had that question regarding Tom's CEO report when he was speaking, and we got disconnected.
So that's not fair, is it, Brenda? Can you remember what you were going to say?
I had to panic there. Yeah, Tom,
you're better than me.
it was just the name of the organization.
Oh, yes, through the chair to the committee. So it is we submitted through the interprofessional primary care team. It was the IPC team is what they're known of. This is and the ministry is supporting heavily supporting the creation of these teams.
Okay, so is this going to replace the family health teams?
No.
It's in addition.
Okay, so and they were working with another community group. You said something about seniors community.
So when this various groups put together proposals for interprofessional primary care teams,
right?
And we were part of two of those submissions, right. And the submission that one of them that we were part of was through Community Care Health.
Okay.
Community Care Health.
Is that a not-for-profit or is that a profit group?
Brent, I would think it's a not-for-profit, but
okay.
I did not check that, and so so they led that, but also within this particular IPC team and proposal was CAMH, St. Joseph's, and other agencies. Yeah. So we
So
will
there'll be a
very,
number of partners
very
working
pleased
together.
to be asked to be
Yeah.
part of that.
Right, right.
Yeah, most of these applications, Brenda, are not a singular organization. It's actually a
Yes.
number of organizations who are working together to
Yes, I
commit
can see
to
that.
taking
Yeah.
on more patients. Yeah.
So who will be doing the actual feet on the ground, connecting with our tenants to make sure that they're connected with a primary health?
So that would be they would I would think that they would through the chair to the committee. I think that they would identify a particular kind of individual within the IPCT team to connect with us.
So would we refer them the tenants? The possible candidates for this service? So
Yes, yes, as to the chair, to me, I think it could work both ways. I think that like with that coordination, we could identify somebody to refer, or through our work in the building, right? They
yes, that's what yeah.
if there was if it ended up that a nurse practitioner, there was enough tenants requiring a nurse practitioner for a day, then that could help identify others in the building. So I think there's the opportunity for it to work both ways.
Because the great problem is identifying people who are not connected. I mean, that's the big
Yeah,
ask.
that's
Exactly,
a big,
and that
yeah,
and through the chair
yeah,
of the committee, that is something that we have to work to help kind of ferret that
yeah.
out to help
Yeah.
to determine
And
who those
And
individuals are.
actually, that piece is quite an interesting research as well as an operational conundrum, because how do you get, I mean, in the Black community, this is endemic. Like no one's getting doctors, no one's getting connections, no one's getting referrals to specialists. So our rates of cancer are through the roof and heart disease, because there's no connection with healthcare, right? So
Yeah, many of these teams, Brenda, have particular targets and community outreach strategies, and
yes,
actually have identified populations like the Black community or seniors. And so
yeah,
it isn't just actually, there's a big outreach piece. But
yeah,
maybe we can come back when these teams are up and
terrific,
running, because I think that
terrific.
there's a lot of operational things, and there's a lot of accountability for that as well.
And the outreach
Um,
component is really key.
exactly,
Thank you
exactly.
very much. Thank
Um,
you.
I saw Vidal come on. Karen, are we ready for the next item?
Madam Chair, yes, you are correct. Vidal is on. We are just waiting for Nadia, who has just a couple of issues. But Vidal, if you give me the okay to put up the presentation, or did you want to wait until Nadia gets on? I know she was having Wi-Fi issues.
Hi, everybody. You can
Hi, Vidal.
absolutely call it up. And then, hopefully Nadia will join soon. I think she's just having some Wi-Fi challenges. And if
And
she's unable to join in the next couple minutes, we can just get going and I'll run with it. That's not an issue.
thank you. Yeah, a few people have been having some Wi-Fi issues today, so we appreciate that.
No
So
problem at all.
over to you. And this is there's two presentations today. This is actually the strategy piece. And after this presentation, we're actually going to be focusing on our actual community safety unit Q3 report that will be the specifics, but this is actually the strategy that we have heard about before. And Vidal, if you want to kick it off, thank you and welcome to the committee. You've come before, and we appreciate you coming back.
No worries at all. I actually am supposed to do the second half of the presentation, but I'll just go with it. So
Madam Chair
prior to my coming,
and
sorry, please go.
Vidal, sorry to interrupt. Nadia has
Yes.
joined us.
Oh, thank you.
Madam
All right,
Chair.
excellent.
I heard that.
Hi,
Thank
everyone.
goodness.
My apologies.
Hi, Nadia.
Sorry, I'm just off site, so I wasn't
Oh,
able
no
to get an
problem.
internet connection.
Oh, no problem. We know that happens, and welcome back. This is a really important item for this committee, and we really appreciate you taking the time, both of you. So I'll pass it over to you and to kick it off.
Absolutely. So once again, thank you for having us back. Much of the content in the first half of the presentation is just sort of a reminder of what we discussed the last time to kind of catch us up. And then Vidal's really going to be speaking to what we're doing, what our implementation plan timelines look like, and how we plan to work with TSHC. So as you know, why we developed a safety strategy for Toronto community housing. We had heard both from staff, tenants, and other stakeholders that there was a level of dissatisfaction with our service delivery around community safety. So using our tenant survey, we heard that 46% of our tenants weren't satisfied or were satisfied with our safety services, but that meant over half of the tenants saw an opportunity to improve how we deliver safety. About half of our tenants expressed satisfaction with the CSU specifically. But again, we saw this as an opportunity to kind of regroup and get input on how we move forward together better. We also had a review of our CSU initiated by the City of Toronto, working with a third-party consultant, and I believe TSHC was involved in that process as well. And so we heard quite a bit, and we presented that the last time to the committee. So based on that, we thought it would be really important for us to develop a move forward strategy around community safety and well-being. Next slide, please. So again, these were findings. So how do we look at safety at Toronto Community Housing and more broadly as the community safety unit? So what we heard from tenants and staff and others is safety is not just the absence of violent crime. It also encompasses feelings of connection and feeling connected to neighbors and mutual support. So how do we make sure that we're providing support services and service delivery strategies that think beyond enforcement and think beyond particular statistics? We also heard that CSU's enforcement model limits the consistent relationship building and community-oriented policing that tenants need to feel safe in their community. So we heard that oftentimes tenants' interactions with CSU officers weren't the most positive, particularly on the family building side. And so really wanting to have a greater presence of members of the community safety unit in communities and not just when things go wrong. So effective engagement, and of course we all know this, but I think it was a reminder, is based on consistent, respectful, interpersonal interactions. This is really critical, and I think our previous model limited the opportunities to do that, and so we're looking at ways to bring that back, either through the community safety advisor model or through other mechanisms to get the safety officers better integrated into larger community and engagement strategies. TSHC must address complex issues. So again, safety is not a one issue problem. It's connected to a multitude of things, including mental health, addiction, community development. And so how do we integrate all these different approaches to the work and in a more integrated, seamless way? And what we also heard from CSU staff and from some of our community members is their experience of policing in the communities through the community safety unit, and their experience working in the community safety unit was not optimal and supportive to their individual circumstances. And so we are going to be very intentional about how we engage with that group, both the staff as well as the tenants that identify as Black. Next slide, please. So again, we looked at the review informing a more strategic approach to how we will be tackling community safety. And so what we developed was a community safety and well-being plan. So we will walk you through a little bit about what the plan entails and what the next steps are on the upcoming slides. Next slide, please. So one of the main,
sorry to interrupt. I just wanted to refer back to the board. I wanted to refer back to the previous slide and want to note that it lays out 5 areas of operational improvement to lead to a more holistic approach to safety built around the well-being of staff and tenants. That seems to be inverted. It should be tenants and staff.
Good point.
That's a fair point. Absolutely. And I don't think it
Okay.
necessarily denotes priorities, but certainly we could look at that in terms of updating the language.
Yeah.
Thanks, Jess. Good catch.
So we can move on to the next slide. Yeah, so what it called us to do was look at expanding our definition. Sorry, the previous slide. There we go. expanding our definition of safety. So this is our updated definition of safety, and it's really important. And I think, Jesse, to your point, prioritizing tenants. So this is our community safety and well-being strategy specific to TCHC, but we have put tenants at the heart of all of the work that we do, and obviously staff experience around inclusion and stability in their homes and their workplaces. So that's our new updated definition. Our CSU mandate. So again, we just refined this to a lot of the best practices. What we heard from tenants both at TCHC and TSHC is CSU's mandate needs to be focused on safeguarding tenants, staff, and property through an integrated model that supports safe, connected, and thriving TCHC communities. And in this case, TSHC communities. The next slide, please. So we also heard a few things from TSHC, both through this process, but also more recently. And this is something that we want to tackle as we move forward with the community safety and wellbeing implementation strategy. So we heard that there is concerns about the experience that some seniors are having with our dispatch center, recognizing that there may be a different way to engage with a senior. As we think about the redesign of our dispatch, how we prioritize calls, we need to think about the TSHC clients and tenants and how we could best support that group. Obviously, we have lots of seniors on the TCHC side, but I think it's a good opportunity for us to engage with TSHC in thinking through that. CSU presence and deployment. So we heard loud and clear, both from staff and tenants, that they want to be involved with contributing to how we design our deployment strategy and how we think about what makes sense for CSU presence. Maybe it's special constables, maybe it's third-party security, but we intend to engage with TSHC around how we will work on a deployment model specific to TSHC. We also are tackling internally, but also this is going to be a conversation that we work with TSHC, is around the roles within CSU. So if we need a safety staff on site or involved in an engagement event with the local community, maybe we need an additional community safety advisor if resources permit. Maybe we need additional special constables. So I don't think we've quite landed on the exact service delivery model. It would be contingent on the needs within TSHC, but that's something we'll need to explore. The other thing that we're thinking about at TCHC, and it's an opportunity for us to strategize with TSHC, is around upstream supports. So what does that look like in terms of us working with TSHC to think about more proactive engagement strategies, either with third-party organizations or with the TSHC staff to support mental health, social service provision, and community-based supports. And lastly, just it's really important to us, and we want to make sure that it's clear to the group today that ongoing engagement with TSHC is going to be critical in our way forward in how we design the work.
And I
So I
see
think we
Jess
can
has
move-
his hand up. So maybe before you go to the next slide, Jess, did you have a question?
I
Comment?
actually had a comment. I've heard from multiple sources, both at uh, our meetings in building and also at regional meetings, that the CSU response time is slow or less than expected. And I'm wondering how that might look if we adopted something that is used in northern communities, where the person receiving the call stays online with the person until there is a responder there. This is both helpful to the person who may be several miles away from the person who is in need, but it gives them some comfort that their challenge is they're being helped in a real-time situation, as opposed to note, we have a work order, we're going to respond to it, and hang up. I think that people in distress need to have some active help, which would be suitable to their needs. Secondly, the people who are on the phone, like both of my nieces, may suffer from PTSD from working in this area, and they would need some sort of support as well. So is there a plan to support the workers, the frontline workers who are getting these active phone calls of people in distress?
So through
I
the
don't know
chair,
if you.
happy to answer the second question. And apologies for the pronunciation, Jess. I just got the update, so apologies there. So with regards to the staff in the dispatch center, we do quite a bit of peer support work and provide them additional support services. Vidal could speak to that more when he gets into it in his section, but that is something we're very intentional about, providing vicarious trauma supports and other supports to the staff. So that is something that we actively do, including training and additional service supports that we provide to them. So that's something that we do. Certainly we can take away the suggestion to keep folks on the phone. I think that might be a resource issue, but it's certainly something we could look at in terms of how we provide support to seniors differently. And that's the commitment in terms of moving forward with engaging with TSHC on how we do this, right? So I think that's a suggestion we could take under guidance from the CSU department to see what's reasonable, but we've certainly noted it.
Thanks, Nadia.
Okay, we could go to the next slide. I believe Vidal's up next. So Vidal's going to walk us through what we heard and how we plan to work with your teams to implement some of these things.
For sure. I do want to address the last question though really quickly. So I understand the point that you're making. I do want to clearly state though that if somebody's in a real-time emergent situation, the CSU is not their first call. That should be the police. And yes, there are occasions where 911 operators will stay on the phone with individuals in an emergent situation. From our perspective, so just to provide you some information, in 2025, the CSU received 144,000 calls for service, 89,000 of which were dispatched. And we have about 4 or 5 people in the dispatch room on each shift. And we only have 150 special constables across the whole city. So on any given day, we're talking about 15 or 16 across the whole city of Toronto per shift. And so for there to be an expectation that there would be immediate response in most of the calls that we get is very, very difficult. So it is a resourcing issue. What we're hoping to do, especially for the sort of lower level incidents that we respond to, is figure out some other ways of bringing down the demand part of the equation so that it does not result in a call to the CSU. And that can be done through integrating our work within our own institution, but then also with our external partners as well. But I just want to make that clear. Like, that would be a very, very difficult thing to do. If we left the call taker on the call with people who called, we would run into some significant challenges in responding to the calls that we do get. What I can say where we need to do a much better job is in follow-up, so that the individuals who did call recognize that their call was answered and something happened, whether it was immediate or not. But I don't know if you wanted to reply at all to that before I keep going.
Yeah, I will say that also the 2 supervisors, Chris and his partner at CSU, are very responsive to calls and work very hard, tirelessly, to address the issues in a much more enhanced way. So thank you for that service. It is working.
I appreciate that. Okay, so after having heard of all of this feedback, the organization worked to establish this community safety and well-being strategy, of which there are 5 very important key pillars. The first of which is integrating services, and it's one of the most important operational pieces of the strategy. So safety issues in seniors housing are rarely solved by one unit acting alone. So a call may come into the CSU, but the underlying issue may involve tenancy concerns, maintenance, mental health, social isolation, repeat conflict, or community vulnerability. And if those pieces are handled separately, we may respond to the incident but miss the actual pattern. So the direction here is to connect CSU more deliberately with TSHC tenant services, community supports, maintenance, and other operational teams. Integrated team meetings are one way to do that. And the goal is to identify recurring issues, clarify who's responsible for what, and coordinate action before matters escalate. Can we go to the next slide, please? The second building block of the strategy is tenant engagement. So for TSHC, this is especially important. Seniors aren't just recipients of safety services. They're often the people who understand the building dynamics the best. They know where people feel unsafe, where conflicts are recurring, where lighting or access issues create concern, and where social isolation may be contributing to risk. So the strategy moves us towards these community safety and well-being plans that are informed by local conditions. That means we don't want to be a generic sort of one-size-fits-all approach. So for TSHC communities, the opportunity is to use existing tenant advisory structures and local knowledge to help shape practical safety priorities. And that could include conflict resolution, tenant-led conflict resolution, better information about how to access CSU, clearer escalation pathways, and place-based supports that reflect the realities of seniors housing. And again, the commitment is not that every issue is going to be solved immediately. The commitment is that the tenant voice is going to be part of how priorities are understood and how plans are developed. Next slide, please. So the third building block of the strategy is equity and safety, and that's not separate from operational effectiveness. It's actually central to it. So a safety service can't be effective if the tenants don't trust it, if people feel dismissed when they call, or if different communities experience the service differently. For TSHC, equity also means recognizing the unique needs of seniors. So some tenants may have disabilities, cognitive decline, trauma histories, language barriers, mobility challenges, or different levels of comfort interacting with enforcement or uniformed staff. So that's why customer service, trauma-informed practice, cultural safety, truth and reconciliation, and anti-racism, they're not soft additions to the strategy. They're part of building a professional, modern community safety service. We also need to create more opportunities for special constables and other CSU staff to spend time in the communities that they serve in ways that build familiarity and trust, not only in moments of crisis. Next slide, please. Jim, I'm appreciating the thumbs up. I got to tell you, it's making me feel heard. I love it. The fourth building block is partnerships and diversion. So a major lesson in community safety work is that not every safety-related call requires the same response. Some matters require a special constable, some require police, some require tenancy action, some require mental health, harm reduction, wellness, case management. If we send the wrong response to the wrong issue, we can use resources inefficiently and fail to address the underlying concern. So for TSHC, this matters because some recurring issues in seniors housing may be connected to vulnerability, health, isolation, or unmet support needs. And so the strategy allows us to look more carefully at how non-urgent calls can be triaged, how partners, both internal and external, can be engaged, and how CSU can focus on its core safety responsibilities while helping connect the tenants to the right supports. So this is going to require careful work. Diversion can't just mean transferring responsibility. It has to mean building reliable pathways with the right partners, clear thresholds, and shared accountability. All right. Next slide, please. And the last one, the fifth building block, is culture and operational effectiveness. So this is where the strategy becomes very practical. So we're looking at all the things we do. We're looking at dispatch. We're looking at technology, our service protocols, the training we provide to staff, how we communicate with tenants. We're looking at staff safety, of course. And then we're looking at the internal operating model of the CSU. And from a TSHC perspective, dispatch, as we just heard, dispatch modernization is particularly important. So we've heard about the concerns in terms of call handling and prioritization and service experience. So a good review of dispatch will give us the opportunity to look at how calls are assessed, how information is captured, how urgent and non-urgent matters are distinguished, and how tenant-facing services can be improved. And that the same applies to service level protocols. So TSHC needs clarity on what CSU does, what regional or site staff do, when issues are escalated, and how follow-up happens. And so I want to, make it clear that in terms of the transforming of the CSU, we expect that TSHC is going to be part of that conversation, as Nadia mentioned. All right, next slide.
Two questions there.
Yeah,
if
please.
you don't mind, Vidal, I'll go to
Of
Brenda
course.
first and then back to Jess. Brenda? Oh, I think you put your mute on.
Sorry. Thank you. Two quick questions because I don't want to delay you.
No worries.
Percentage of, I don't know if calls is the right word, are handled by your third party providers as distinct from your own community constables? What's
So
the,
third party security?
yeah,
Yeah,
like,
they're not meant to be hands-on at all. So third party security, their responsibility is access control in many ways. So ensure that people don't get into the buildings that they're not
yeah,
supposed to be in.
right.
But if something happens, they call us. They call the CSU.
And are they present? Do they like roam the region? Are they present in buildings? Like, how do they?
So there's two versions. There's static security. So we do have some buildings where we have security presence, whether it be 24
Right.
hours a day or 12 hours a day,
I understand.
depending on need. And then there is a team that responds to fire alarms in particular, because we need fire watch. So they stand in the hallways when there's a unit that has to be sort of evacuated because of a fire. I will say that static security is meant to patrol the stairwells and walk around the buildings on a sort of a regular cadence.
Yeah.
We monitor that through their manager at the third party organization, and we rely a lot on our tenants to let us know whether or not they're indeed living up to their billing. But they're
And
not meant to be hands on. Sorry, Brenda. Apologize.
yeah, yeah. Okay, this is linked to my general question about. I, I'm sorry. I've seen these issues for decades
Mhm.
in my community work. So it's like
Right.
nothing seems to change, and it all seems to revolve around this inherent contradiction between enforcement and engagement.
Yes.
You know, the soft hand, the hard hand, and I just thought would it help if you had greater control of the staffing. I mean,
Mhm.
you
Oh, it's
can
windy out
develop
there.
and train staff that are under your own control in ways that you want them to operate, right? When it's
Yes.
third party, it's very, very difficult. So, I
Yes.
mean, this doesn't require an answer because I know it's a more nuanced answer, but I'm just raising this because it seems to be this recurring problem. I remember when the community constables were developed. I mean, I go back years, you know, and
Right.
the same issue of racism still is there. I mean, I can't tell you how many decades I've had of people talking about this. And given that 40% of your tenant base are Black, this is no longer just a minority interest. So,
Mhm.
um, you know, just these recurring issues, recurring problems, recurring reviews, and I can appreciate your work and the progress you've made, but it just seemed to me when you don't have control over your staffing in a way that, is there any hope that you'll be getting rid of third party, or will you be continuing with the third party providers?
That is a conversation that is alive. The
Okay.
third party security bill is significant. And
Yeah,
if we can spend similar money and
on
have
your
that
own,
control that you're talking about,
absolutely.
that is
Yeah,
something that we're looking into for sure.
because this was the same problem 20 odd years ago,
Mhm.
25 years ago. Yeah.
I hear
Yeah,
you.
thanks, Brenda. I'm going to get to you, Jess, but Tom, were you wanting to react to one of those comments? I'll let you go ahead. Oh, you're on mute. It's one of those muted days.
Yeah.
Yeah, thanks. Through to the chair, to the committee, just regarding third party, we have 5-6 buildings where we do have third party coverage. It's not 24/7. We are currently working with TSHC in terms of updating and validating optimal buildings to have that, and so we will be submitting that updated list to TSHC shortly, so we can provide a copy of to the board, so you know where we currently have that third party. But I thought it would be helpful to share that it is limited right across our 83 buildings. We have it in 5 to 6, and then also we have to understand that when working and listening to the tenants, many of them raise this matter around third party. They do see it as a way for eyes at the building, a better sense of security. So that is a consideration for us when we're looking at the spectrum of options and how the plan will evolve moving forward.
Thank you. Trying to ignore you, Jess, with the questions answered that you were wanting.
Oh, hell no. Board.
How it is, right?
I support Brenda's statements about the need for relationship building and having CSU staff who reflect the cultures of the tenants. Third-party agencies, by and large, are short-term employers. I believe. I don't know if that's factual, but certainly CSU, if its hiring practices were adjusted to engage with people who live in the buildings or who reflect the cultures of the buildings, there might be an advantage to both parties. That's just an overarching statement. But my bigger questions, I don't know if you were here when I commented on 19% of the population of TSHC is over the age of 85. And their need for monitoring assistance through the CSU should be prioritized. This may include working strategically with Ontario health teams and implementing it a bit quicker than I see in one of the slides. The first mention of expansion of proactive patrols and prevention is in 2028. I sure hope that isn't the case.
Okay, sorry, I want to make sure you're done. So I'll answer the last one first. Certainly
Thanks, Jess.
proactive. Yeah, thank you very much for the question. Proactive patrol is not something that will be on hold until 2028. That timing slide is really interesting. It also pushes the CSU transformation out to like the 5th year of the strategy. That's impossible. The strategy requires that we transform at the same time as we're trying to build in some of the new operating procedures. I do also want to mention, so part of proactive work at the CSU, particularly with special constables, is around that sort of proactive directed patrols, which you may be familiar with. So when I looked at some of the 2025 data of the directed patrols that we did engage in as a unit, 15% of them were at TSHC buildings. And I can provide the actual detail of that. I do want you to know that that is something that we prioritize, particularly with Toronto senior housing communities, because they're not the vast majority of the buildings in TSHC are not sort of the ones that are the most provide the most volume in terms of calls for service. That doesn't mean that nothing's happening, and so we try to be around a little bit more often in those. But so to answer your question, no, directed patrols and proactive activity is not something that we are pushing off until 2028. The first part of what you said related to addressing the specific needs of seniors, this is where there's got to be a bit of a team approach in this regard and an integrated approach. I totally agree that public health can be a part of that conversation. And we can work better together with individuals that aren't necessarily in special constable uniforms to provide some of the needs that exist in seniors housing that we could move the special constables to other particular responsibilities. We also have, as part of the team, community safety advisors who are meant to be more present and connected to both staff and tenants in the buildings. And I will say that we're hiring 4 more because that team is also under resourced. So right now, each of them has about 80 or 90 buildings as part of their portfolio. We're hiring 4 more. We're going to try to bring those numbers down a little bit. So hopefully the individuals in the seniors residences will see the CSAs a little bit more often as well.
To jump in because I think Lawrence and Jim both have their hands up. So Lawrence, sorry, I could when the slides are up, I can only see so many hands. So Lawrence first, and then Jim.
Yeah, what's the relationship of OPSU, Ontario Provincial Services Employees Union, with this?
OPSU is the union that the special constables are a part of.
Oh, okay. Thank you.
No worries.
Question. And Jim?
To the chair and to Vidal and the other members, staff and the board that are here, I'd just like to say I lived on George Street, 291 George Street, from 2006 to 2017 when I was relocated due to the fire.
Yep.
I really appreciate everything that's being done to revamp security, the CSU. My son also worked as a third-party security at one of the Wellesley Street buildings. I'm feeling very hopeful to be able to live out the rest of my life here in dignity and safety. I think this is you've taken a great step towards making us feel safe. And I hope to see everyone else appreciate it as well. Thanks.
I appreciate very much you saying that through the chair. I think we start talking about these issues and I look at, data across all 2,100 plus buildings or whatever and talk about safety and sometimes forget that we're actually talking about people's homes. And so whenever, you remind us that we're talking about people's homes. So I appreciate that very much.
Yeah, thank you, Jim. That was really, really helpful to get that perspective. You've lived it for quite some time. Go ahead, Vidal.
Okay, so this slide shows the implementation roadmap. So I do want to emphasize, as we were just talking about a second ago, this is phased deliberately. We're not trying to change everything at once because that wouldn't be responsible. But there are certain things that, even though they look like they're way down on the other end, that are happening earlier. So in 2026, the focus is on preparation, alignment, governance, and the CSU transformation plan. So that means building the structures, clarifying the priorities, and engaging partners, including TSHC, before moving into larger implementation. In 2027 and beyond, the work becomes more visible through these community plans, the community safety and well-being plans, sort of the pilot sites associated with those, any service model changes, improvements to technology, and certainly evaluation of the work that's happening. That pacing is important. It allows us to make progress while we manage risk, cost, labor implications, and operational capacity. So for the board, the key assurance I'd offer is this: implementation is going to be staged. It's going to be evidence informed. It's going to be as transparent as possible. We're not going to claim success simply because activities are underway. Like, we need to track whether the changes are actually improving coordination, tenant experience, response quality, and safety outcomes over time. Next slide, please. So this is the slide that I want to leave this board with. So TCHC is committed to ongoing collaboration with TSHC as the strategy and CSU transformation plan are developed and implemented. That collaboration is going to be practical and focused. So TSHC will be included in consultation processes related to the transformation of the CSU, particularly in areas that directly affect your communities. So deployment and resource allocation, the service model, dispatch modernization, the community safety and well-being plans, upstream supports, and overall implementation priorities. Your role is not simply to receive updates after decisions are made. Your operational experience, your tenant feedback, your understanding of seniors' housing and seniors' needs should help inform how implementation is shaped. And at the same time, the collaboration has to be grounded in the realities of shared resources and organizational capacity. Us at the CSU, we serve both TCHC and TSHC communities. So our responsibility is to make thoughtful decisions that reflect risk, need, available resources, and the distinct context of different tenant populations. All right. Next slide, I believe, is the last one. So in terms of next steps, as I indicated, implementation work has already begun in 2026. The immediate focus is to continue developing the CSU transformation plan, organize a CSWB coordination team meeting with TSHC staff in June, and use that table to discuss the issues that matter most to TSHC. And I've listed them already: dispatch, deployment, service expectations, upstream supports, and how TSHC communities can be reflected in community safety and well-being planning. So thank you very much for the time and happy to take any further questions.
Yeah, thank you very much. And I do want to tell people that we have an extensive report that has also been sent to us, and we will be sending it to the committee that fleshes this out a little bit further. It's long and detailed, and I think we'll have some future opportunities to dive in. When do you think, Vidal and Nadia, that we'll hear back from you? What's the plan with regards to that? Because I know that we want you to get the work done, and it does feel like a long period of time. But I do feel like TCHC is being considered a little bit more with this updated report. It felt like we were kind of not as involved in the last time you came. So I really appreciate the efforts you've made. It feels like we're more included now.
So through the chair, maybe I can start and then Vidal, you can jump in. So our commitment is certainly to work with TSHC staff in the development of the process as well as TSHC tenants. I think, Tom, perhaps we can talk about the cadence of when we would come back to this committee, potentially
Yep.
annually. So right now we're on a biannual reporting cycle to our board, in large part because the community safety and wellbeing plan is TCHC focused to start.
Yep.
But potentially annually unless there's interest in something a bit more frequent. I think anything beyond biannually would make it difficult for us to demonstrate movement. And so the commitment is for us to provide meaningful updates as they come.
That's great. And in the meantime, we should be seeing things in our regular reporting anyway. Tom, did you want to add?
Yeah, through the chair to the committee, just adding to what Nadia said, I think like Nadia is conveying the TCHC kind of reporting back to this group, but I certainly think even when we meet with Vidal and the group in June, right? If there's any kind of specific action or work following up on that, or where we have been moving ahead on our community, like when we receive the template on community safety well-being from TCHC, if there's a couple of buildings where we're implementing that, we can share that with this committee. Each time we meet, that I think that could be something, or quarterly, or that I think that cadence would be helpful, because we hear security, right, is the number one issue that we hear from our tenants, and so it goes without saying it is a priority for us. So I think there's TSHC, this staff, and this committee's cadence, and then also ensuring that it's kind of backed up with the work that TCHC is leading, and providing that overall accountability and leadership for the work to come back, whether it's once a year or every 9 months, whatever what works. Does that make sense?
Yeah, thanks, Tom. And knowing that the staff are actually are engaging regularly in this work, you could bring it back to us as well. Brenda, last comment, and then we're going to let these folks go.
Yeah, sorry. My main concern here, two things, is one is what we learn together, we can share together. I mean, you have many, many thousands of seniors in your buildings as much as we have thousands of seniors in ours. So hopefully there's a spillover of shared learning and shared application. My final point would be the devil's in the details, as always. And my concern when you're working with community agencies and partners is making sure people do follow up and do their role. Your shift to a notion of well-being as distinct only from safety is admirable, but it's very difficult to implement because really your mandate is mostly safety, right? And that inherent conflict. And so it's all going to depend on your ability to hook people up with supports and services beyond what you can provide, or indeed even should provide. You're not a social welfare agency, right? So my main contribution here would be to ensure that whatever arrangements, whatever partnerships you build, that they do timely response to any referrals that we may make, or connecting tenants with needs, and that there's some follow through and some monitoring of that relationship and some accountability to each other as partner agencies. Otherwise, it all falls apart and just becomes a great interagency meeting that's held 4 times a year. And we've all been on those committees for too many hours of our life in our professional capacity. So those would be my comments. Good luck.
Thanks,
Thank
Brenda.
you. And through the chair,
our
I'll just
team is out there. Go ahead, Vidal. Go ahead.
No, just quickly in response, I appreciate what you're saying. I think the definition of safety is a really interesting one. I could point to a whole bunch of stats that could say that physical safety has improved in many ways, but
Yes.
people's
yes.
perceptions of safety has
Perception
not.
of safety.
All right,
Exactly.
and both
Yeah.
of those are tremendously important, and that's why the safety conversation has to extend beyond special constables responding to calls for service. It has to include things like making sure places are clean, that people have their various vulnerabilities are met. Otherwise, we will continue to have this dichotomy that exists where
That's right.
I'm saying, no, you're much safer, and they're saying, no, I'm not really, buddy. I'm not feeling that way. And that's why it's important to be integrated in our approach. But I totally appreciate what you're saying.
Well, and perceptions of safety are often influenced by the lack of supports and people's sense of unsafetiness, if that's a word, is often a reflection of all the other things falling apart. So, it is a delicate balancing act, very nuanced act. And but my main concern is the follow through, because this will all just be paper unless you can get people, hopefully. I can remember a time when community housing used to employ lots of youth workers and support. I mean, those are the days. So, I mean, I know what you had before and what you've lost. So when we look at our current situation, it is a reflection of those cutbacks over the last 20 odd years. And young people were groomed to be youth leaders and then counselors, and then ended up working within the organization. And that helped with the safety and community well-being sense. And we lost a lot of that with the cutbacks.
Thank you, Brenda. And thank you, Vidal and Nadia, for, I think that you have our support. And, I do agree that, we are not the, Toronto Community Housing also has lots of seniors. And I mean, we do, we're glad that we're going to actually learn on both sides. But I think you're heading in the right direction. Thank you for the extensive report. We will send that for people. And we look forward to having you back. And it's convenient. The next agenda item is actually our quarterly report on safety. So this is a good, it's hopeful in terms of what we'll see. So thank you very much. We really appreciate you coming, and good work.
Great.
Thank you all. Have a good afternoon. Thanks so much.
Thank you.
Thanks.
Bye.
Great, and thank you for everyone for your thoughtful comments as well. This is an important item. And now, Grant, how are we doing? We're going to move on to the next item, which is actually our community safety Q3 report. So this is what's happening on the ground, as opposed to the strategy. So we'll pass that over to Grant.
Thank you. So through the chair, we have the Q1 2026 CSU report on TSHC safety activity. This is the reporting at the more granular level that the CSU and Vidal, who was just on the call, has been providing quarterly for several quarters now to TSHC, and the data that's in the report is a subset of the data they have to give us a sense of where trends are happening and more specifics around the types of calls and specific activities they're doing, whether they're reactive or proactive. So the overall reporting from the CSU for Q1 of this year shows a 7% increase in calls. So he was talking about calls previously, for example, at the beginning. That was 2,576 calls in the first quarter. It's up about 167 calls compared to the same time last year. And most of those calls and the increase are due to an increase in trespassing and parking complaints. And in the report, a little bit further on in the report, you can see a breakdown in the table of the different types of calls and some of the numbers there. Also in the report, they talk about reported crimes against people and reported crimes against property. So the reported crimes against people, these are smaller overall totals. There's a slight increase between the last quarter of 2025 and the first quarter of this year. The crimes against people went from 20 to 27, and reported crimes against property decreased though, and it went down a little bit. So it's 107 versus 117 in the last quarter of last year. However, it is up from a year ago. So these are important data points that are part of the analysis that was being discussed at some level in the previous item and some of the actions. There are also some highlights in the report with regards to some of the proactive activities, patrols, some of the audits that they do for safety audits, etc. And they also talk about some of the follow-up activities, which were in a way somewhat summarized in the previous item as well, talking about how they're working with Toronto Seniors Housing to align patrols, to conduct engagement with tenants, to continue to work on the data analysis aspect to all of this, to work on building specific safety plans, and as well to look at security resources, including third-party security coverage. There's a section of the report that also talks more specifically to some of what are identified as high needs buildings. And I think one of the things that we'll continue to work with the CSU on is the alignment of the high needs buildings with the latest data analysis points. And then they have some next steps as well, which somewhat mirror what they just spoke of, but they're going to be continuing to work on more targeted data around buildings for follow-up and some of those aspects that were discussed. The development of safety plans, looking at where there were increased calls, for example, or reported crimes. And they talk a little bit more specifically about some of the regional aspects there. And then they also talk about aligning future indicators with the community safety and well-being strategy. So what Nadia and Vidal were just speaking to in the last item, so that the indicators that ultimately are being reported through this safety activity quota reporting will be in alignment with the safety and well-being strategy. Those indicators are still to come, I believe. And I'll pause there to take any questions.
Jess?
Yeah, Grant, thank you very much for the report. One of the things that seems to be, I don't know if it's missing or not available, is the number of tenants per building and how they are how many callouts there are, or how many requests for CSU there are per building. I know that our building has had a lot of callouts regarding parking, and part of that is due to misinformation or miscommunication between various elements of staff and CSU. I'm hoping that this can improve and that there's better direction given and feedback. The feedback loop is also completed. I think the feedback loop is the most important element of it all, so that there can be closure and that perhaps some of the reactive responses from tenants can be mitigated and fewer calls can be had.
So
Comments,
through the
Grant?
chair. Yeah, so thank you. So thanks for the question, Jess. So through the chair, there is data that is available. They do have this data at the more granular level, so at the building level. And you are correct that there's an aspect around, for example, parking enforcement and the parking complaints. About 10% of the calls, roughly, that they're working on for TSHC are to do with parking. And ultimately, you're right, there could be other actions or follow-up to help prevent those recurring parking issues from happening. So we can take that back and have a discussion with them about that.
Thanks, Grant. Brenda? Tom, did you want to respond to that first?
Just quickly through the chair to the committee. I think just to this parking and where an enhanced kind of relationship interface and even reflecting on the revision to the agreements will assist. So one of the in being at the buildings and talking to the tenants, one of the issues that creates parking challenges is when there's a capital project and workers will park in our parking, and so this is where we need to be more intentional in terms of our conversations to with TSHC around these capital projects. You need to be aware of this, and there needs to be a response to this. So it is really we are delving into this more, being more forensic, but understanding these are real issues to the tenants that we can alleviate some of these if we just are really just, as I said, more intentional around the direct feedback to TSHC around some of these matters, such as parking.
Thank you. Brenda?
Thank you. These numbers are based on the calls to the CSU telephone service? Like, what are the numbers that you've shown on our charts here? Who's gathering that data?
So through the chair and to the committee, yeah. So these are the calls that are made to the CSU. Right. they call them calls, but they're essentially incidents. They are
Yes.
validated, so they will
Okay.
actually, it's the CSU that analyzes and validates the data and then provides the reports to us.
And is there, I have no way of knowing if these numbers are low, high, medium, because I have no context to compare it to. But is there possibly a possibility that there's an under-reporting of concerns? That is, people are not phoning CSU, and so we're getting an under-reporting of what's really going on. I'm just trying to figure out how we can suss out the accuracy or the efficacy of these figures for us in terms of our planning and our thinking.
So through the chair, oh, I do see Tom has put his hand up.
Yeah,
so maybe
Tom, go ahead.
I'll
Maybe you have a brilliant answer to that.
No, through the chair to the committee. Not a brilliant answer.
Not brilliant.
Brenda, what we hear from the tenants is they do not call CSU quite often because they simply don't get a response. They have given up.
Yeah,
and
I
so that is
that's what I wondered.
part of our work around dispatch and this whole dispatch is having to, once again, really just understand more, kind of what's happening. Yeah, thanks.
So then it's incumbent upon us to find ways for us to identify and respond to whatever some of those needs, unexpressed needs through CSU phone calls. I mean, we're running a risk of relying on these figures and thinking we're doing okay when really it's an under-reporting. So is there ways that we can capture people's, I don't mean to say discontent, but if people are concerned or they see things happening and they don't report it because they've been, dissatisfied in the past, what are the ways that we can capture some of these incidents or concerns so that we're better prepared and better able to handle?
Yes, through the chair to the committee, Brenda, I don't have a immediate response to that because you raise a really good question, and I think now with this kind of more intimate work with TSHC, we can ask that question to them, just about how what might we get it anecdotally, right?
Yes.
And so but that's where we are right now. So I would say that digging into this a bit deeper will be important. You raise a really good point.
I would suggest it's not relying on just CSU improving their processes, but I think it may behoove us to have our own processes. Okay, that I don't want to create parallel systems, but sometimes you almost have to, but just so that I don't want us to be missing out on the forest for the tree and people's perception of safety. We've just mentioned.
Oh, did we lose Brenda? Yeah, for those of you that are still in line, we are going to be looking at one way to actually look at this is in the tenant engagement survey, which actually asks everybody about their many things, including safety, and that's why we actually know that safety is so high on that. But we will make sure that we follow up on that, and these quarterly reports are going to continue to be very important as we actually see the rollout of the strategy and see whether we're seeing some impact. Anything else that you wanted to add, Grant, before we move on to the next item?
So through the chair, no, I think it's been covered, and so we are continuing to work with the CSU on these different fronts, and these data points will be really important. So good points here made today in this discussion. Thank you.
That's great. Thank you. And for many of us actually at different points, getting feedback from the tenants around overall safety will be important because we know we have identified that as a really important part of our strategy as well. So thank you, Grant. That was good timing in terms of the strategy. We're going to move on to the last item, which is also another meaty item. And we do have a deputant on this.
Madam Chair, I'm sorry for the disruption. I've just got word we do not have a deputation.
Okay, it's no disruption. You're being a helpful support to our meeting, Karen. So don't ever don't mind that. We're going to move on, and I'm going to ask Deanna is leading this piece, which is actually really good timing too, and that's our report on our community programs and partnerships update.
Thank you.
And welcome
back,
Brenda. Go ahead, Deanna.
Excellent. Thank you. So through the chair to the committee, I'll keep my remarks as focused as possible and high level. I want to make sure we have time for questions. I think today we do have time for both, which is fantastic. And as we all know, this update is to provide a snapshot of what we're seeing across the community programs and partnerships portfolio. And I'll be focusing on Q1 of this year. Sometimes it feels like we're so deep into Q2. This is a bit of a look back, but it was a really busy and active quarter. And I'm looking forward to talking you all through it. So just to slide 3, Karen, if that helps you, if you want to go to the next slide, thank you. So just want to ground us that all of our work is really focused on 3 key areas of our strategic directions and enablers: tenant engagement, innovation, and partnerships. And that informs how the report is organized today. So what that means in practice is we're really focusing on where tenants are engaged, partners are aligned, and our programs are really supporting aging at home. So just want to ground us in our strategic directions. And now I will talk us through some updates from Q1. So just on to slide 4. So tenant engagement, as usual, continues to be an active area for us. In Q1, we held our first STAC meeting of the year in February, which was very exciting. Staff have also worked with STAC alumni members to curate or craft the first ever STAC information session. So what this session is focused on, delivered in April, so I'll talk about that more during the Q2 update on the portfolio, but to give you a bit of a sense, it's really focused on supporting as STAC has grown from 8 alumni members who many had multiple years of experience on the committee before we grew. This was meant to provide those other 16 STAC members with a sense of continued support for understanding their role, so they can feel like they're engaging actively in the sessions. And this is directly from feedback we received from the STAC committee. So Q1 was really focused on working with the alumni members, and we're really thankful for their experience and their help to sort of craft I think it was a 1.5 hour session around the importance of the STAC role, and also creating some space in that discussion to share ideas about further ways we can support STAC members to thrive and provide their feedback and their insight as we continue the work at TSHC. So a very active first go and start of the year with the STAC committee. So on to the next page, some other notable results. Again, Q1 is a very active quarter. There's a lot of planning underway. So when you see this number of 108 meetings across the portfolio between staff in the community and programs and partnerships team and tenant circles, that's really because at the end of last year, we gathered those priorities with tenants. We understood where they wanted to focus, and that has allowed us to spend a lot of Q1 getting ready and mobilizing for the busy season that is really happening now and is upon us. As we know, the hot summer months keep us very busy. Not to mention, these meetings helped organize a lot of the recurring activities that are helping in Q1 as well, including coffee socials, movie nights, things like that tenants help us lead and lead themselves over the course of the quarter. We also had a significant engagement effort with Mayor Olivia Chow. This had been mentioned to the committee and the board before. She visited 12 buildings over 2 days to celebrate Lunar New Year. We don't have perfect attendance, but we know in the numbers we kept, it was hundreds of tenants attended across the 12 buildings, and really thankful to the staff at the mayor's office, but also at TSHC, who led the coordination, the promotion, and the execution. It brought a lot of joy to the tenants to be provided some treats that were celebratory of the new year, and to spend some time with the mayor as she made her way through the different sites. Also in Q1, staff spent a significant amount of time updating our database of volunteers, and we now have on record 414, which is a 38% increase from our last count, which was early last year. So really, number one, that provides us with great sets of contact information as we aim to reach as many volunteers as possible with our updates, invites to our volunteer meetings, things of that nature. So it plays a very tactical role, but it also helps us monitor our growth. So really signaling the efforts by the community programs and partnerships team, and of course, other volunteers to recruit their neighbors, friends, to be part of that group, that cohort of individuals that are really supporting their communities to engage. I'll speak on the Volunteer Skills Day in a moment. That's another really big outcome of Q1 that we're really excited about in community programs and partnerships. So on slide 6, let's talk a little bit about partnerships. So our agency-led program volumes remained relatively consistent quarter over quarter. So we're maintaining that level of agency programs for our tenants. And based on our reporting with partners, so every quarter we gather reporting from them, there were over 2,200 program sessions resulting in 11,000 tenant interactions. So to be more specific, as you know, in the strategic directions dashboard, we talk about in or around 200 to 300 agency-led events per quarter. That number does not encompass recurring sessions. So some of our agency-led programs have 3 sessions a week or multiple sessions in a month. So that 2,200 sessions is meant to reflect the actual number of interactions happening in our rec rooms during that 3-month period. And those 11,000 interactions can look many different ways. It could be a tenant accessing a food program, so receiving food and returning to their unit. It could mean attending a workout session or an education session. So it takes many different forms and of course, reflects possibly more than one interaction with tenants at a time. So just want to be specific that that number is still really strong in terms of the ability of our partner agencies to have reach in our communities, and really wanted to signal that there's quite a bit of activity in Q1 is another very busy quarter in our common spaces. And of course, a thank you to our 60 plus agency partners. They're very committed. They're very engaged in the programming that they provide. And as you likely saw on the following slide with a few of those impact stories, we just want to provide a snapshot of, the unmeasurable interactions, if you will. There's numbers in this report and in the dashboards I provide you as the committee. But, this is meant to just provide you a snapshot of some of those unmeasurable touch points, interactions that help us understand how tenants feel about the programs they're receiving, but also a reflection from how the partners are interacting with our tenants. So again, we ask for quarterly reporting from our partners, and impact stories are a big part of what we request they provide to us. And this is just a few that signal the progress that happens in the community every day. And on slide 8, again, wanted to raise this milestone for the first quarter of the year. The Community Programs and Partnerships team launched the first ever Volunteer Skills Day with nearly 100 participants across the 2 sessions. So as you all know, as committee members, we in the Community Programs and Partnerships team have always worked towards skills development and education being a part of being a tenant volunteer at TSHC. One of the ways many tenants have experienced that is at our regional tenant volunteer meetings. We bring forward presentations of information and key insights for those volunteers who attend. Last year, we heard from tenants that they love those opportunities. Volunteers love those opportunities to build their skills. And we're particularly interested in the skills that enable them to be strong volunteers, work collaboratively with their tenant circle peers, work collaboratively with staff, work with their local community to drive the engagement in the community that they want to see and fight social isolation together as sort of an overarching goal. So this session was to provide a professional development style day focused specifically on their role as a volunteer. And it was facilitated by a young lady named Jessica. I shouldn't say young lady, a wonderful facilitator named Jessica. And she is a certified volunteer engagement professional. She's worked with hospitals across Canada and across the city. She works with Volunteer Toronto to support their education component. And provided, again, this full day sort of session to our 94 attendees across the 2 sessions. So, testing out this format was really an opportunity to respond to the request of tenant volunteers to continue to learn and evolve in this role that they have taken on in their community. And we're happy to report that participants filled out a survey and reported that they felt an increased confidence and increased readiness to be a TSHC volunteer and feeling as though they'd like to see this continue in future years. So we are looking to build that in 2027 and beyond to have this sort of standalone day, in addition to those in-year learning opportunities that we will continue to create. And this will be supported as you see what's next. As we conclude the Skills Day, we are actively now working on the release of our volunteer handbook. It's been mentioned to the committee previously. Q2 is a very busy time to release that, and that is a very tight companion to this Skills Day. Providing that handbook is another way to provide volunteers with information they need to empower them in their role. So the next slide, I made a slight change. I moved down what's next a few slides because I didn't want to step away from Q1 until I spent a moment on all the photos that you see here. Beyond our numbers, which are very important, especially in forums like this, our work is really about the people and the communities that we can help build. So, I hope you had a chance to look through the collages of images for Q1. These are specifically just reflecting the last few months. You'll see some photos of the Volunteer Skills Day on slide 10, the mayor's visits on slide 11, and then just a miscellaneous gathering of a few other shots of our wonderful volunteers, tenants, and staff. So it's been a really wonderful Q1, and I'm really thankful for the staff and the tenant volunteers who've helped us have so much activity and flurry over the last few months. Looking ahead to 2026, our focus is on strengthening our systems that support this work. So there are two kind of overarching headings I've provided here. Operationally, we're focused on strengthening our structure and our operations to enable our core work. So we are working on continuously improving and simplifying our tools and our processes related to community activities, funds, and use of space, because those are very tangible tenant-facing procedures, processes, partner-facing procedures and processes that have a really deep impact on their ability to engage in the community. And we're also putting clear structure around our engagement and partnership portfolios through the reallocation of existing headcount in a number of areas. This includes using that reallocation to create two distinct portfolios around engagement and partnership under a single umbrella, and also enabling our capacity with additional community service coordinators, temporary contracts, to again help us meet that growing demand and keep up with the pace of engagement and community development that we are feeling at the front lines in our buildings, which is a very good problem to have. The more demand we're feeling and the more pressure we're feeling, though challenging at times, it really signals that more tenants, for us, more tenants are engaging, more partners are working with us in our communities. In terms of programs and partnerships, you'll see there in that box, in addition to our core work of supporting tenants and agencies to lead in their communities, there are a number of initiatives that are also underway. You'll notice here that we're focusing on continuing our partnerships with the City of Toronto, with Toronto Community Housing on a number of different fronts, as is articulated in the 2026 annual plan. And I will continue to report on progress against these initiatives to the committee throughout the year at every quarterly report that I provide. But just to signal here, in addition to doing the core work we do to grow the number of tenant and agency-led programs, we are focused on trying new things, moving forward with innovative and unique ways to engage the community, fight social isolation, and help tenants age in place. Looking ahead to Q2 specifically, in terms of next steps, which will be my next period of reporting on behalf of the team, we're looking to not only maintain our programs, but there are a couple key initiatives that are underway right now, like the spring regional tenant volunteer meetings. They just wrapped up last week. I mentioned the rollout of the tenant volunteer handbook over the last number of weeks and over the next number of weeks. And a lot of furious preparation for the summer season. In particular, we have over 40 barbecues scheduled this year through Community Activities Fund. So lots of logistical, tactical work, both by staff, but also with tenant volunteers, again, to enable them to be the leaders we know they are in their community and take center stage in providing these opportunities for their neighbors in their building. And I look forward to providing more information about these in future reports. Staff are very excited about the season ahead of us. So with that, strong engagement this quarter, stable program delivery, and a real focus on meaningful impact is where community programs and partnerships has been laser focused. And with that, I am happy to take any questions.
Thank you, Jess.
Thank you to the chair and the board. Deanna, thank you for that very good reporting. As a recipient of many of these programs, I can say that they are well received and certainly are growing. Having new CSCs available is very valuable to engaging more comprehensively with residents and giving them the opportunity to respond to their needs. One of the areas that I'm concerned about is the people who are socially isolated. I've heard recently that loneliness is equivalent to smoking 15 cigarettes a day. And that to me is a real health challenge. So having the opportunity or the need, either with partners or on our own, to have a needs assessment provided or even a friendly visitor program initiated would be very, very helpful. Regarding partnerships, I also recently heard that Good Shepherd is providing servicemen who are homeless with ways to reintegrate into communities. And I don't know if our rapid rehousing program has reached out to Good Shepherd to see if we can participate in supporting those who have served our country.
Thanks, Jess. Deanna, do you want to respond to that? And then I'll ask Brenda to comment.
I think
we are having one of those days,
Deanna
aren't we?
Rosen, yeah, it's everybody's taking their turn.
Does anybody else want to? Maybe I'll ask Brenda. Do you want to make a comment or a question?
Sure.
That
Can you hear me?
Yep. We're going to have to
Yes,
end
we
this
can.
meeting soon.
Okay. Two quick things. I really appreciate your work with volunteer training and development. I think that's terrific, and the spin-off effects will be multiple over the years with a group of active engaged tenants, right? So bravo to that. My second question was about partnerships. And when partners work with us and come into buildings, who are they answerable to? Do they answer to our staff? Are the tenants involved?
Oh, jeez.
This is funny.
This is cursed.
Am I back? Hello?
You're back. And,
Okay.
and
No,
maybe
we
you
just
can
lost
answer
Brenda.
that question that Brenda had, Deanna, which is actually, because I know you know the answer to this in terms of
Yes.
how the partnership agreements for partners that come in, and how is that all
Yes.
managed? And I think there was
Yes.
another question around social isolation that you're trying to answer in terms of, and it was very nice to see that anchored in your comments and how we reach out to those that are most vulnerable.
Yes. Okay. So I will try this again while I still have good connection. So through the chair to the committee on Jess's first question around loneliness and needs assessment, I think you're right on point, Jess, in terms of the work that we're trying to do as an organization. Tom has spoken to, we've been working on research with Dr. Agarwal to better understand the needs of our tenants. So that provides us a lens or a profile on those, mixed with the work we're doing in community programs and partnerships. What jumps out to me is, we have 59 or 60 tenant circles in 83 buildings. That means there's a subset of buildings where the work needs to be done to dive a little deeper and see if we can get more tenants involved. I'm not saying a tenant circle is the only indicator, but it's one where we can tell that tenants are engaging and involved and want to support their community, and that has ripple effects on others. So I totally resonate with your comments there, and that's part of our focus. I don't want to speak on the rapid rehousing and Good Shepherd piece. I may park that for maybe Brad to speak on in terms of roles with agencies, if he doesn't mind. But before I do that, to answer through the chair Brenda's question around partnership agreements. So when we are bringing a new partner into our communities, yes, we do sign what is called a partnership agreement with those organizations to solidify the focus of their programming, confirm a number of logistical elements of our partnership around access and use of the space, insurance and liability, things of that nature. And right now we have 64 partnership agreements that represent those 200 or so programs per quarter happening in our communities. I hope that answers your question, Brenda. I caught the tail end of it.
Great.
Okay.
Thank you. Thank you. Thank you. And Brad, did you want to comment about how initiatives that are happening across the city and the rehousing, how we connect?
Yeah, through the chair. The supports that are put in place and the providers that are selected went through an RFP process with the City of Toronto and Social Development. And part of the RFP process and ensure that they had the qualifications to support their clients through the first year of supports that are provided through the program.
Yeah. So, Tom?
Yes, through the chair to me, I was going to respond. I just had something to add on to the comment around the partnership and the agreement piece. But if
Go ahead.
Brad is done, and Deanna mentioned this in the presentation, but just around the structure change that's happening in that area is there now is going to be a manager of partnerships essentially, and so that individual will have very kind of focused accountability for those agreements. So there's the manager of partnerships, and then there's the manager of engagement, and I can't remember this term, but then they will look at how those partnerships gets executed in the home. So it will be a nice fit.
Great. Thanks, Tom.
That's
Jess, did you want to?
supplemental. Yeah.
Yeah, go ahead.
Supplemental to that, the reason I mentioned our veterans is that frequently, and they represent between 5 and 10% of all homeless people in the city. This is a fairly substantial number of people. In other jurisdictions like Alberta, the Department of Defense has rated mini homes in communities. And this might also be part of the portfolio being developed or strategy being developed by the city to create community-led support structures for veterans, with the support of Veterans Affairs, with the support of various housing initiatives at both provincial and federal level, that would show that senior veterans are not being missed, that they're not being neglected. And I think that's very important to our society as a whole.
It's a great idea for a partnership, and maybe we'll just leave that with Deanna in terms of just actually maybe some opportunities to look at a group that certainly has could be connected in. Boy, I have to say, thinking back over the number, just really a few years, and how much work was actually has happened since we came together as an organization, because this was actually a really high priority area. I know it's great to see the volunteer piece and the partnerships, and there was a lot of work that had to be done, and on both the operational side, and partnerships also require a lot of sitting down and really hammering things out together. So I just want to say that it's really good to see that it's coming together. I think it's exceeded my expectations in terms of the timeline at this point, to see where things are at. Personally, Jim, you've been here for those number of years. Do you want to add anything, or do you have any comments just to make sure we get your voice?
I don't have anything to add. I'm just, I agree with what you said. I think we've
Yeah,
come
it was topical, wasn't it?
From where we were when I moved in here to where we are now. I think it's been a great improvement, and it shows in the relationships between tenants, in our coffee times together every 2 weeks, which I didn't attend today because of the board meeting.
There you go. Where's the coffee? We're gonna have to get that next time. Jess, maybe the last comment for you? Oh, I think it's a mute issue.
There we go. Yeah, 2 buttons. Must hit 2 buttons. I don't know if this is an appropriate time, but at STAC, I've suggested that there could be a more engaged level of STAC commitment to hear the voices of tenants through going to coffee meetings, to engaging with the tenants, perhaps to get a bit of training in terms of how to navigate challenges. And I think that would make the STAC members more valuable to the Toronto Seniors Housing, but might also help to alleviate some of the pressures on CSC. There are 24 of us, and if we each took 4 buildings, that would take care of pretty much the entire portfolio. And that way, the meetings that we held in conjunction with the surveys that are held by TSC might create a more fulsome perspective of what the needs of tenants are.
Deanna, do you want to take that away?
Yeah, through the chair to the committee, yes. Jess brought it up at the most recent STAC meeting, and it was a great conversation. And I think where it landed was, staff can support how STAC gets organized around joining other buildings, engaging with other communities. I think it's a great idea, and the STAC committee was very supportive of that as well.
Great, thank you. Well, thank you for that presentation. If there aren't any other comments, I just want to say we structured this meeting a little bit differently today to try to have a little bit more time for conversation. I do apologize that it does mean that we're going to have another meeting in the not so distant future. But I think it's good if we, with these big agenda items, that we have some time to actually talk and provide feedback. But any feedback you ever have about the meetings and how your voice is heard, we're always open to it. At this point, we're going to move to the last item, which is the adjournment. Thank you, Deanna, for that presentation. Is there anything else you wanted to add, Deanna?
Nope, that's it. Thank you.
And Deanna's on vacation and she came in for it. Jim?
I have a question for Karen. When I look at everyone's name, just about everybody is unverified. What does that mean?
It's nothing really big. It's just if you didn't set up an account with WebEx. So there's free accounts that you can set up.
And I go through the WebEx account to access the meeting. But I still come up as unverified.
Yeah, it's a funny thing, isn't it?
But you'd have to log in. We can chat offline and I can walk you through it. There's 2 different ways. Like sometimes you just have the app that you go in and it just hasn't verified your email because you haven't signed in through your email, just through your username, say Jim Meeks.
Okay.
Yeah.
Thanks. Yeah. That helps.
Thanks, Jim.
It's not a big deal,
funny thing when it comes up, as mine comes up and unverified too. A lot of us are unverified today, so I think that. But thank you everyone for it. And I know we had a few technical challenges today. I hope that those of you who are online who have joined us have found that the meeting was informative. And we'll be back soon. And that meeting is going to be also important with the results of our tenant engagement survey and some other important items. So with that, I'm going to ask for an adjournment. Can I have a motion to adjourn? Thanks, Jim. Seconded by Jess. All in favor? Terrific. Thank you again. Thank you to the team for putting together some great reports and for your great engagement with TSHC. Enjoy the nice weather. I hear it's not going to stick around, so and we'll talk soon. So have a good night.
Great.
Bye, everybody.
Thanks a lot, Linda. Good job.
Thank you,
Good evening,
Linda.
everyone.
Christina,
Bye. Thank you.
Thank you for sharing.
Have a great evening, everyone.
Thank you.
Bye-bye.
Thanks, everybody. I
Thank
was the
you.
one that was worried about my technology, and
And you
I
were
was
the only
I was
one,
fine.
yeah. It was great.
All right, so I will talk to you soon, Karen. Thanks for
Yeah,
all your
we'll
help.
see you on Thursday.